Headmistress of the Ghana National College in Cape Coast, Juliana Owusu-Ansah, is calling for a boost for the emergency preparedness of the school as students of senior high schools in the country as well. Her call follows the death of a 17-year-old student, Ruby Teku, who died following an asthmatic attack during the school's weekend inspections. The headmistress is counting on the collaboration between the Ghana Health Service and the Ghana Education Service to employ nurses and doctors to take care of the health needs of students. Richard Kojonyako has been following this issue and has filed this report.
The sad incident happened on Saturday. The student is alleged to have died when they brought her to the Cape Coast Teaching Hospital. The house mistress was organizing an inspection and was moving from one dormitory to the other. So the student had an asthmatic attack, and the students around tried relentlessly to revive her with the inhaler. The student's inhaler reportedly was empty. They used other inhalers from other students, but that did not work. And so they called in the school nurse. The school nurse came and instructed immediately that the students should be sent to the nearby facility. That was the Cape Coast Teaching Hospital. They came to the Cape Coast Teaching Hospital, and according to the doctors, the student, the 17-year-old student, Ruby Teku, was dead on arrival. Parents of the deceased are not happy with the development, and they have vowed to take the school on. According to them, the child, when she was admitted to the school, had a medical report. The medical report suggested that used to have asthmatic attacks, and so should not be doing some kind of jobs like scrubbing, like flushing of toilets. But surprisingly, the child engages in all of that, and they feel that the school authorities were a bit negligent on that one. Also, the parents allege that when the student was being brought to the hospital, there was no school authority or no nurse that accompanied the students.
And in fact, me asthma. No so to cheap batters. Me an asthma would me say 10%. Parazo ban nina elmo ekonuma onya attack. Na so many year juma ejumre 10:30. Nina me friend me ban Ruby say me scrub it. Yes, so mutimi makuma no flash toilet. Our asthma. Our medical report and so. Menti asiye afeso akra ne yare nso no teachers be in school no student na de me ba ne call hospital me why no every term no musi yencha almost 170 Ghana allowances for musi more nurses wo school mu allowances for doctor allowances for watchman but me ba ne yare no manya mu bia afa akola na call hospital kampo omudi bi wo school mu ba se si won ntimi afa me ba na anko taizi. It's just nurses for being almost say teacher ni biology teacher and they taking the post according to the student there. Say nurse in the share me ban on biology teacher who's a post and call off. This is a charge the school authorities have denied. According to the school authorities, the child was brought in the company of the nurse of the school. They admit that the senior house mistress that was conducting the inspection was not part of them because she was dressed inappropriately, and so she asked that she was going to change and then join them. Later on, she joined them, and so the accusations by the parents are not right. They want the parent to come to the school, sit with them and see whatever they would do about it. I've also been speaking with the assistant headmaster in charge of academics at Ghana National College, Mr. Stephen Bediakusechi.
Because the senior house mistress was in charge of inspection, she wasn't properly attired, so she had to rush back quickly. And indeed, she was the one who called me to go to the hospital. When I went to the hospital, I went to the doctor, and then he made a general complaint that he thought that Ghana at age 61 should be in a situation where we could easily administer CPR when such situations happen in the schools. But when the nurse and the student went to the hospital initially, they met a different doctor who looked at the girl and gave his comment, which actually alerted the nurse that the situation was serious. So the nurse went out and called the senior house mistress that she should hurry up, but the situation was dire. Then the second doctor came in, who saw the two students, thinking that they were the only ones who actually brought the students.
So the headmistress of the school suggests that, if possible, one doctor should be assigned to every senior high school so that possibly within a week the doctor could attend to the needs of a student, so the student will have the best of health in the academic activities. She wants government to also employ some of the graduate nurses that are still sitting in the house to also augment the healthcare system in the various senior high schools we have in the country.
At every school, now that they are increasing intake of students, every school will have a good, well-resourced medical sports facility for the students. Because schools can no longer, we can't continue. The numbers are just exploding. So the schools cannot afford to bear all the medical bills of the students. We can also not just go on and appoint a PE teacher to be a medical officer. All schools need nurses and, if possible, doctors. So I would wish that the government will employ some of these newly turned out nurses who are not employable anyway and send them to the schools, so medical attention will be strengthened in all the schools around. We need them. We need the nurses and we need the doctors. At least, even if we have, each school has a doctor who will attend to the students once a week, it will improve a lot.